I'm Susan McGuire with Resources for Seniors. I work out of the 5 Points Center for Active Adults, and I am a trained SHIP counselor as well as a senior care coordinator.
Hi, I'm Heather Arcuri, and I am the Western Wake Service Coordinator, and I work out of the Cary Senior Center.
We're here today to talk about what is telehealth. We're getting lots of calls and questions about telehealth. It seems to be a new phenomenon, but it really isn't.
So Susan, can you tell me what is telehealth?
Well, have you ever been to your physician's website and gone into the patient portal and made an appointment? Or have you ever called a nurse and asked a question by telephone and had the nurse return the call? That's telehealth. What's advanced with telehealth now is that it becomes in a more electronic form so that you can use telehealth from your home computer. You can use it from a laptop. You can use it from your cell phone or your smartphone, or you can use it from your iPad. And what it is it offers us the ability to be able to reach our doctors and our healthcare providers without having to go into the office. So you're actually telecommunicating with your health professionals.
What is the expansion of telehealth waiver?
That came about on March 6th of 2020, and it fell under the COVID-19 waiver for Medicare that was part of President Trump's emergency declaration. And what it does, it allows patients to be able to get other services that they normally aren't able to get. So it puts a waiver onto what those Medicare services are. For instance, now you can use telehealth, and that's why we're talking about it if you're a Medicare recipient. And what it allows them to do is, it used to be that you could only use telehealth if you lived in a rural area. That restriction has been removed. So that waiver now allows anybody anywhere in the United States that has Medicare to be able to use telehealth. That's whether they're in their own home, they're in a nursing home, they're in, they're out on a farm. It doesn't matter where you are, you can use telehealth. And it also expanded the amount of the number of people that are providers that can provide the service for telehealth. So that includes now doctors, nurse practitioners, clinical psychologists, and licensed clinical social workers. That wasn't always the case. In addition to that, it also provides flexibility for the healthcare provider to reduce or waive the actual cost of using telehealth care.
So can anyone use telehealth?
Yes, anyone that their insurance covers it can use telehealth. And we'll talk a little bit later about those who may not have an insurance carrier, what they can do as far as telehealth. As long as you have a smartphone or a laptop, iPad, you can have access to and use telehealth.
Okay, so I know this is a big question, is how can one connect to telehealth?
Okay. The way that you connect to telehealth is by going to your provider's office and calling them. And when you call them, what will happen is they will give you a link, or they'll give you a website to go to, or they'll give you an app such as Zoom that you need to download, and then they'll give you a code, a link to that, and they'll set up an appointment time with you. You'll go on your smartphone, your laptop, click on that website. In this case, in some cases, it's like Zoom, and you'll put in that passcode, and then you'll have access to face-to-face conversation with your healthcare practitioner.
So how does one find out if their doctor uses telehealth?
Good question. Not all offices do, but the majority now are doing it so that their patients do not have to come in if they do have the COVID or suspect of having COVID-19. And this way the patients won't be coming in to expose the waiting room, or if people are in the waiting room with already some type of illness it allows them themselves not to be exposed. So it's really a barrier so that people can be safer in their health care. So you can call your doctor's office and find out if they have telehealth, or you can go on their website. Some of them will actually tell you, go directly to my website and sign up, and you can enroll and do the appointment via the website.
Got it, okay. So if I am on Medicare, can I use telehealth?
Absolutely. That is one of the expansions that was done with that waiver 1135, was to allow anybody on Medicare to be able to have access to telecare. Now, that doesn't mean that all visits via telecare are covered. There are certain restrictions on them, but anybody who has Medicare, Medicaid, VA can use telehealth.
Got it, okay. So if someone had commercial health insurance, are they able to use telehealth as well?
Yes, most insurance companies now are allowing their beneficiaries to use telehealth. Even some of the large companies, I know the one that we use for Resources for Senior, our insurance carrier, has just sent us notice that we can use telehealth, and also that they may waive the cost, the co-pays for it. So that's kind of exciting news. So most of the big carriers, yes, are not only letting people with their insurance do the telehealth, but a lot of them, good majority of them, are waiving the co-pays with that too, which is kind of neat.
It is. And what if someone's on Medicaid?
On Medicaid in this state of North Carolina, they also can use telehealth. Each state sets its own policies regarding that, but in North Carolina, it has been approved.
Okay. Now, there are some people out there that do not have health insurance. What are their options?
Okay, so uninsured people can call a physician's office or a facility, say it's an urgent care, and see if they offer telehealth. And then ask them how they can link with that to do the telehealth. In some cases, they have to download an app that's at a fee onto their smartphone in order for them to do the telehealth services. But nobody's denied telehealth services if they have the communication abilities to do it.
Okay. So in general, when should a Medicare beneficiary consider using telehealth?
Okay, there's a lot of situations that can come about that you can consider. The one that I was most familiar with was I went to visit a specialist 2 weeks ago, and he told me the specialty practice that he's in. He said, when you're talking to other people that use this type of specialty, let them know that we're doing telehealth. And what he said that the procedure is, you call that office, you get an appointment, and then you get the link, and then you make that connection. And in this case, the one that he gave me the example of was a client who had a chronic illness, and he was noticing different symptoms that were coming up that were not usual symptoms. So by using telehealth, my physician was able to change his medications to help compensate for those new symptoms that he was experiencing. So you can call for telehealth appointments if you need to check on your prescriptions. Maybe you need a prescription reorder, you can do that. Maybe you were due to have a routine checkup. Maybe it's time for your 6-month checkup to check on your blood work. Maybe you're diabetic, maybe you have high blood pressure, maybe you have high cholesterol. All of those things they can talk you through the telehealth. Other things you can go to telehealth for are, suppose you have a runny nose or a cough, or you have symptoms and you're not sure, is this an allergy, or is this the flu, or is this COVID-19? Well, by talking with your healthcare professional, they can establish whether you need to come into the practice or whether they can probably help you just through the telehealth, maybe find out a little further what those symptoms are, and maybe if it looks more like hay fever or an allergy, that they can then get you a prescription instead of you having to go all the way in to the medical office.
Okay. Now, if I felt like I was experiencing COVID-19 symptoms, what should I do?
We want you to contact your healthcare provider immediately. Call their office or go online and set up that appointment right away. Many offices are using that on the online Zoom program, and it's really not that difficult to use. When it comes to the COVID-19, the telehealth offers a way for your healthcare practitioner to look at your symptoms, to evaluate them, and then to determine whether you need to come in or whether you need to stay at home or whether you need to go to the emergency room. So if your practitioner suspects that you might be infected with the virus, they can send you to a testing facility and provide instructions for that follow-up care. Now, there's an exception to this. If you're a person that falls in the high-risk group, say that you're either elderly or you have a compromised immune system, or you have other type of chronic illnesses, maybe a lung disease, something like that, then they would prefer that you immediately call your doctor's office and proceed to make an appointment to go in and be seen.
Okay.
So you don't want to delay that.
Mm-hmm. So can I get prescriptions refilled through telehealth?
In some cases you can. It depends on what the prescription is. Certain medications like psychiatric medications, chemotherapy agents, narcotic pain relievers, all of those you cannot get through telehealth. But the majority of things, if you're taking in something for like acid reflux, or maybe you're taking a medication for high blood pressure, those routine type of medications, in most cases, you can get them refilled. With Medicare clients, they're encouraged them to get a 90-day supply. And anybody that's getting their prescriptions filled right now, if they can get a 90-day supply, that would be the better way to go. And then if it's something that you've been taking and you can't get the 90-day supply because when you go to the pharmacy, they say, well, we can't fill this, then you have to kind of follow up with your insurance company and making sure that they'll lift that waiver or lift that restriction so that you can have that waiver so you can have a 90-day supply.
Okay.
Yeah.
All right, well, you have been very helpful. Thank you so much for answering all my questions today.
You're welcome. Thank you. And if you have any further questions, you can get in touch with Resources for Seniors at 919-873-72. Yeah, all right, let me do that again. Yeah. If you have any questions, you can get in touch. I don't even know the number. Hang on. All right. If you have any questions, you can get in charge. You can, third time the charge. Okay. If you have any questions or any further questions or anything regarding any type of services or help that you may need at this time, you can call Resources for Seniors at 919-872-7933. There is someone there Monday through Friday, 8 to 5, answering the phone. If you want to have more Medicare-specific questions answered, you can call our SHIP office at 855-408-1212. All of the information that I've shared here you can find on the CMS or the Center for Medicare and Medicare Services website, and they have several links to telehealth, prescriptions, all of the things that we've covered.